Welcome to the Rotunda, the longest-running maternity hospital in the world and the busiest in Europe.
We're here! Woohoo!
It has seen the birth of close to 1 million Dubliners, and this year, some 25 new babies have been added to that number every day.
Black hair just sticking out.
Hello!
Oh my God!
I know.
It's a place of extreme highs and devastating lows. During the pandemic, one of the most challenging times in living memory.
I'd like to be in there, but the numbers aren't going down at the minute.
We have a date.
It's agony and ecstasy side by side as people experience events which will change their lives forever.
I'll do it again.
Events to be remembered and retold for generations to come.
Pandemic babies. Look at you.
I qualified in the heights of coronavirus pandemic, but it's been a strange experience. Like, obviously staffing was a bit all over the place, lots of people out on COVID leave or close contacts, so you really had to step up straight away, take on your role as midwife. There was no easing into the job. People that you work with, when they take off their mask and you're like, oh, that's what your face looks like. Like, I've worked with you for a year, but I don't know what you look like.
With COVID cases fluctuating throughout the pandemic, the level of access to the Rotunda for birthing partners has been limited. Over the past 18 months, restrictions have increased and decreased depending on the level of the virus in the community. Caroline is expecting her first baby. She was induced in the hospital 2 days ago. Her journey to motherhood hasn't been as traditional as she'd hoped.
Growing up, I would have wanted to get married and have 4 kids and not realising the practicalities of that. But you know, when you're growing up and you have this dream, but life, I suppose, it just didn't happen. I did have boyfriends, but they didn't work out.
Now in the delivery room, COVID controls allow Caroline to have her birthing partner with her until after the arrival of her baby.
Your mum is going to be your birthing partner, yeah?
Yeah. I found myself at 38. I'd gotten a house and I had my career, and you know, I thought, you know, time is pushing on and I really need to explore my options before it's too late. So I decided I was going to do it alone because I didn't want to live my life without having a child. So I got a little credit union loan. And I suppose I haven't looked back since.
All right, you just take your time, Pat.
Caroline decided to do a cycle of IVF using a sperm donor and was fortunate to become pregnant on her first attempt.
Have you got children? Oh,
I have one.
You're like me, I'm just going to have one and done.
Bit late starting, you know.
Yeah, me too. As part of the IVF process, you choose the sperm donor, and how you do this is through online. So it's a little bit like, you know, online dating, but you're getting a baby at the end of it. For me, it was important that they actually wanted to meet the child eventually, so that was an option as well.
Get things
How old
started.
is your child?
He's 10.
Ah, lovely.
Yeah. Not a bother on him, he's great.
Does he bring you loads of joy?
He really does, yeah. Do you know what you're having, or are you going to leave that as a surprise?
It's a surprise.
Excellent.
Yeah.
Love the surprise.
I have a feeling it's a boy, but you just don't know.
I'm a single mother myself, and I felt that we bonded an awful lot in regards to how it is to be a single parent.
I'm glad I did it.
I'm glad you did too. Because now here we are, we're getting to meet.
Yeah. I think everything is planned out for you, isn't it? Sometimes I feel like the IVF worked, it's just chance, like it just was meant to be. I'm hopeful that eventually I will meet someone. Time will tell, and for anyone who's seen Bridget Jones' Diary, it doesn't mean that I can never meet someone. You know, she had 2 when she was pregnant.
Caroline had hoped to manage her labour with just gas and air. But after 3.5 hours in the delivery suite, she has decided to get an epidural.
Is that a contraction again?
No, that's the
Relief.
You know, a few daunting moments are like, oh my God, is it going to be okay? Is the birth going to be okay? Am I going to be a good mother? You know, the usual, but that's all normal.
It's kind of just manipulating the tape up your back, alright?
Yeah. Is the hard work done now?
Well done, yeah.
Oh,
So,
thanks, Brian.
You're going to feel the benefit of that in about 15 or 20 minutes.
Good morning, our patient's midwife speaking.
Valerie was admitted to the hospital 30 hours ago, not long after her first contractions. Because of COVID restrictions, her partner Giovanni has been able to join her for just 5.5 hours each day.
Yeah, he was staying in the hotels for the whole time that I was there. He was just buying the hotels and staying outside, so that when visiting hours were open, he could just come straight away.
This is their first baby. Valerie and Giovanni were together just a few months when they found out that she was pregnant.
It definitely wasn't a planned pregnancy. It wasn't planned.
I was out with my friends, and then she rang me, but I thought she was messing at first. So I hung up, and then she rang me back. She goes, no, I'm serious. I took the test, and she sent me a picture of the test, so I was like, I just froze, and I couldn't talk. It was a very big surprise.
But like we were never like devastated or, you know, like I feel like we never really had like a nervous sort of.
Yeah, no negative thoughts.
Yeah, it was really kind of calm and chill. We met at a party. We were in the bathroom. I don't know why we were in the bathroom, but he got the shower head. We were dressed like. He got the shower head, spilled it all over my hair and makeup. I had a drink in my hand. I spilled it on him. I was like, what are you doing? And then, I don't know, we just kind of really got along, like.
History after that.
Yeah.
Now that Valerie is in the delivery room, Giovanni can be by her side until after their baby arrives.
When I came into Rotunda with my contractions, I thought that they were bad earlier, and I was texting my mum. I was like, yeah, it's like an 8 out of 10. And she was like, trust me, that's not an 8 out of 10 if you're able to text still, like.
With first-time mums, especially when they're that little bit younger, you have to be really patient with them. And kindness, I think, goes a long way. And also just kind of breaking the ice, really. Giovanni, when you get a chance, would you mind popping out baby's first outfit? Just his hat, nappy, vest and a baby grow, please.
A vest?
The balloon.
Oh, you have them all labelled out.
Yeah.
You're very organised. So he's got one. That's so cute.
Yeah.
Newbie.
I had my 3 children in the Rotunda hospital and they were now grown up. I suppose I would have had empty nest syndrome. I decided to do something for myself and I applied and was accepted as a student midwife. I now concentrate a lot of my time to the women and the babies that we look after, and it's so fulfilling every day. Pandemic has literally upped the numbers amazingly. Each lockdown, we're paying for it 9 months later. It never stops, and so which means I'm never going to be out of work, so I'm happy.
Caroline has been 6 hours in the delivery room. She's hoping her labour has progressed.
Oh,
Sorry, no.
you're
but-
okay. Oh,
Okay, so you're actually 9 centimeters.
you're kidding me.
What? Already? I'm already there? Like, I couldn't believe it.
Her mother Vivian is here as her birthing partner.
Hello. Hey, Mummy's
In
here.
the beginning, Vivian wasn't keen on Caroline choosing to become a solo parent.
When you first said it to me that you were going to get IVF and going to have a baby on your own, I was taken back what you were saying. I didn't know what to think. I remember I said something and your dad told me.
Oh, you always have to be different.
Yeah, it was hard.
Yeah.
It was.
Because it wasn't a sort of done thing.
Because I would be old-fashioned as well.
Caroline's labour has really progressed, but her midwife Pauline is concerned that her baby's head still hasn't descended.
I'll get you a drink of water.
She has called in obstetrician Maeve Ogan for advice.
It's always difficult for people when they've been in hospital. Sometimes they'll meet quite a few people and all of a sudden, you know, she met me for the first time. It is hard for people when they're meeting lots of different people and meeting people at a time of stress really for them.
No better woman than Vivian to help break the ice.
I'm Caroline's mammy. We're not alike, believe it or not.
So today you says, oh, you can do all the talk, and I was like, well, that makes a change.
Would you mind to put the lights on for a minute?
Guess how many minutes I was in here when she was born? You'd love that. You'd love this.
She's a great yapper, great chatter.
You know the railings outside? I lived on the North Circular Road. She was my second. My young fella was 14 months.
Bring her anywhere.
And I have to tell you, she was the best baby in the world. She never woke us.
Caroline wants to cut to the chase, keen for an update from Maeve.
Is everything going okay?
Everything's going fine. The next room, as you know, is opening up really well. But the problem is the baby's head hasn't come down.
It's not that the baby is necessarily too big, it's just the angle at which it's entering into the pelvis isn't right. Sometimes nature will correct that, sometimes we will correct that, sometimes time will correct that.
Going fine. So what we'll do is we'll examine you at 6 o'clock, okay?
Brilliant.
And hopefully we'll find the baby's head has moved down. Just examine you then and see what the story is.
Thanks so
All
much.
right.
Thank
We'll
you.
see you later.
Bye. Thank you.
Thanks, guys.
Thank you.
Thank you.
Can I tip you?
Yeah.
Sometimes someone tipping off, it can be annoying.
Ma'am, you think just what you do, just keep your hand on me.
Here, yeah.
Yeah, or on me shoulder.
Yeah, between here and here, yeah.
But don't rub it.
Just put your, that's all right, whatever you're comfortable with.
Yeah.
When you're really tired and you're in a bit of pain, you're just not feeling your 100%, and whoever is closest kind of gets it.
Have you children? Are you
I do. I have a little man.
What age?
He's 10.
That looks good, but I think Caroline's having a boy.
Okay, ma'am.
All right, I know if someone...
Chat.
Okay.
But I'm like this, drives me mad.
Because I'd be trying to help you.
Pressure again.
Valerie has been in labour for 6 hours. With an epidural numbing her pain, it is now just a waiting game.
Are you feeling those contractions?
No.
You've done well, though. You've done well.
Thanks, baby.
So is this the first grandchild of your families?
Yeah.
That's lovely. Must be loads of excitement.
My mum wasn't too pleased.
Was she not?
No.
And are you living at home with your mum?
Yeah.
And you're 20?
20.
You're 20, oh my goodness.
Yeah. When I first told my mum, I actually got my little brother, he's 5. I got him to, because I already framed my scan. I did it after my first scan. I framed it and I gave it to him and I said, here, bring that to Ma. And he ran in, he was like, Ma. And then she was like, what is that? And she looked at my sister because she's older than me and she's like, is that yours? And she's like, no. And then she's like, Valerie, oh my God. And she was really shocked. Her friends, they were like, that's fine, like it's a gift, like there's nothing wrong with it, it's an amazing thing, like. So she was really happy then as well. And you know, I'm 20, like I'm not a teenager, like.
Oh gosh, she'd be really excited now to be a granny.
She also texted me, she's like, keep me updated.
So she's waiting patiently at the phone to hear what's going on. And what about yourself, Giovanni? How old are you?
19.
How are you? How do you feel about being a daddy?
Great. I was happy, but when I told my mum, just made it even better because I knew I had people to rely on, and she was excited to be a grandmother.
It's just enough space for your body to curl up. I'm a huge believer in mums in labour. Once they've got the epidural in, the first thing I say is, do you want to close your eyes and go to sleep? If you're tired enough, it'll feel really comfy. And the daddies as well often get forgotten when it comes to the whole process of labour and childbirth. It's not much now, it's just a little yoga mat. But honestly, when you're that tired, I don't think you care.
Valerie and Giovanni have managed to sleep through some of the labour. Her midwife Juby suspects that Valerie may be fully dilated and ready to push.
Turn this light on.
Come on, baby. We're ready for you.
Sorry, no, I'll take that off.
When she was like, okay, it's time to push, I'd wake up, I'd be conscious, I'd be aware, I'd push, and then as soon as she'd be like, okay, the contraction's gone, I'd just fall asleep like I'm dreaming. I don't know what I'm dreaming about, but I'm dreaming. And then it was just the same cycle, like over and over again.
Now there's a lovely contraction there.
Right, go
Do you
for
want
it,
to go
so.
for it? Big deep breath in, right into the bottom. Brilliant.
That's it, babe.
Brilliant. Good. Good.
You got this.
Well done. Nice and slow. That's it. That's it. Well done. Well done.
I seen the head and I was in shock. It was there, like literally happening, and I'm watching, and then just I felt like so blessed.
Yeah. Good.
That's it, babe.
Well done. Good woman. There you go.
That's it, babe.
Well done.
You go ahead.
And open your eyes. Look at your baby. Oh my God. 352. Hello.
And voila, baby was born, and that was it. It was actually almost textbook.
Here's your baby.
My heart opened up and just allowed like something to enter, and just another part of me it's there, and I felt whole.
Now. No, hello, mister. Hi. You giving a cough? Good boy.
It's like he's just always been here, like.
Yeah, it's just like he's been somewhere. He's been somewhere with us, like my whole entire life. He's been there.
He almost looks like he's smiling. Look how cute he is. Hi.
He's the image of Giovanni.
Oh my God.
He looked familiar to me. But everyone keeps saying that he looks like me. But I just think he looks like someone I know, but I don't see him looking like me yet.
You look like your daddy.
He's made me more responsible. There's someone out there that I have to take care of now.
Hello, baby. Hello.
I've always wanted a boy, like my whole life. It just made me feel so like whole and like just so excited to meet him, like, so.
Hello.
We love to see when a mother comes in with her daughter in labour, because you know that she's going to really keep her grounded and calm, and she's been through it before. They know that their daughter is going to be able to do it, and they give them all the support in the world that they need. It's just a different experience when the mother is with their daughter in the labour ward.
I'm with my daughter, I'm worse than the patient. I said I can't. And she's 39, she's nearly there, I hope.
Brilliant.
Yeah.
Well, congratulations
I'm
in
afraid
advance.
going a bit.
You'll be fine.
Yeah.
You'll be fine. Enjoy it.
Consultant Maeve Ogan has been called to check Caroline's progress. Although nearly fully dilated, her labour has stalled.
I suddenly start going into what I felt was like a pain. Things didn't feel right in my body, didn't feel right.
You okay?
Yeah.
We're going to see this baby, okay? But unfortunately, 90% chance it's going to be a cesarean section. The neck of the womb got to 9 centimetres quite efficiently, but unfortunately baby's head stayed quite high and slightly tilted, which meant that it wasn't moving all the way down the birth canal. So, what we're going to do, we need to get you pain-free, and then we need to examine you again in the operating theatre, okay? If baby will come normally, we'll do it. All right? We'll do it. Are you okay for us to do the safest thing possible for you? But it just hasn't moved down the birth canal at all.
I have a weird fanny.
You with me?
I knew what
Did you say what I think you said?
Yes.
Oh, come
We're going to bring her, and you can be there.
Can I bring it? Thank you.
No bother.
I'll
I'll see you soon.
They're going to bring her to the theatre.
And which room are you? You're in
She's
here.
10 or 11. I'm glad. God, the face. I tell her, I thought I have the baby myself.
Oh, I know.
Caroline has been transferred to theatre. Although nearly fully dilated, her baby's head still hasn't descended. It has been determined that the safest option for delivery is a cesarean section.
Given everything that was going on, the baby's size, and the long duration of events until that point, the safest thing for mum and baby was determined to do a cesarean section.
Okay, so we started.
Ma'am, you're hitting my
Sorry,
face.
sorry. You want the head of the bed down?
No, it's coming up.
It's a gorgeous little boy.
Is the paediatrician in the room, yeah?
Baby was delivered and was just unresponsive immediately after birth.
We're going to get baby over to the baby doctors.
I brought the baby to the Ohio and started resuscitation.
I was waiting and waiting and waiting to hear the cry, and I never heard the cry. I just wanted him to cry so that I knew that everything would be okay.
I was like, oh, come on, Noah, give me a cry. But it just didn't happen that way.
Thank you.
No worries, it's all very straightforward here.
I got something was, everything else wasn't. Can I have pregnancy?
Yeah. Three greens, please.
Your daddy?
Yeah.
The baby's okay.
Yes. You're okay, you're okay.
The paediatric team has been called in to help with resuscitation.
He's got all the right people around, okay? So we're all the doctors in here. Yeah.
And then we use the button to ring up.
Compressions, please. Do the trolley. Do the tube, please.
Which tube do you need?
Oh yeah, wait, up a bit. So that's up good there.
Yeah.
I'm sure we're thinking up there. Have another quick listen. Do we switch turns there?
Looking nice and pink now.
Bitch, John's to be here. Apart from that.
You're like, you're okay, you're okay.
So the relief that you feel is just incredible.
So now this image of he's gorgeous. And she had the same colour hair as well. Don't know, you don't. Isn't he gorgeous? His little face. I'm in love. Oh, wait, she sees it. Oh, look at him, Caroline.
I'm in love. Are you gorgeous? He's like, he's got granddaddy's eyes too. You know me, don't you? Don't I sing to you?
It was just amazing out in this world. Just the eyes to look at each other.
Hello, little man.
Kiss the face off him.
Oh, I still do. We have kissing time.
Still has the picky name.
It's Connor, Ollie, or Noah.
What you think?
We'll go with Noah, Mama.
You like Noah, don't you?
Yeah.
Yeah, we want to.
What do you think? Noah, Edward, Brian, Donegan.
So I'm working in the Rotunda now the past year and a half. I work with women during the pregnancy and up to 1 year after the baby's born. The pandemic in the past year has meant that women couldn't bring their partners to their first scan, the 20-week scan now, but at one point they couldn't even bring the partner into that, so they've been kind of doing this whole pregnancy journey on their own. Before the pandemic, your partner was able to be there by your side through the whole journey. Sometimes now they're outside waiting for a phone call in the car so they can come straight in when you're in active labour, which could be hours, you know. A lot of people have felt not traumatised by the birth experience, but by their time in hospital being alone. You know, felt like they were a burden asking the midwife for help, just suffering on their own and their bedside with their curtains around them. So that's definitely been a huge thing.
She's waiting now.
Galway native Orla is expecting twins. Her husband James and herself have a 3-year-old boy and are delighted at the prospect of extending their family.
It's only then when you realise when someone says you're going to have twins, like,
Yeah.
I knew what it was like to have one, and I was saying, then, like a few people said, like, do you know what twins is like? Like, you're not going to get a minute. It's only then when it would hit in, like, God.
I'm so to tell him that. Thanks so much, Jane. Bye. Bye-bye.
Orla caught James's eye with her enthusiasm for DIY.
Bought a shower off James. I got a discount too, actually. You can tell them then about meeting in a nightclub.
Well, you had to come back the second time for the shower door, because
Yes.
I took something out of the shower door, otherwise she'd come back again.
Yes, could he come back to see the shower, but that didn't happen. But here we are, 11 years later.
After 2 years trying for a second baby, Orla became pregnant.
We had our first scan then at 12 weeks. James wasn't allowed into it. So just couldn't believe the midwife was like, we have 2 heartbeats, and I just started bawling, just absolutely bawling. And I suppose the way I looked at it was, oh my God, we're over 2 years trying and now we have 2 babies, which is, again, I kept saying to James, like, we are just so blessed.
At this first scan in Galway, Orla was also told that this would be a high-risk pregnancy. She is now 16 weeks pregnant. Yesterday, a consultant in Galway diagnosed twin-to-twin transfusion syndrome, which puts the survival of both babies at risk.
That was scary, that I probably will never forget. We had to leave Galway University and drive straight to the Rotunda. Quick pack a bag and get on the road. That was a scary journey, probably one I'll never forget, to be honest.
Orla and James need the Rotunda to assess the twin-to-twin diagnosis and see if there's anything they can do to help. Because of COVID infection controls, James has to stay outside in the car.
James couldn't come in, so I went in for the scan and the consultant confirmed that it was 2 girls. And it wasn't the big gender reveal we had hoped for, but I ran out to James in the car and told him that we're having our girls. And I suppose I just prayed and prayed so hard for them. And everyone, oh my God, we have amazing support, don't we? There is candles lighting across the country.
Today in the Rotunda, surgeons will attempt to save the babies with in utero laser surgery. With access for partners confined to a 2-hour period, during which Orla will be in recovery, James has returned home, but will be able to join Orla for a scan in the morning.
Do you know what? Quite lonely, yeah, it's tough without him. Yeah, it's been a crazy 2 days, to be honest. So he was just able to drop me to the door last night.
The twins are identical, so they share one placenta between them. Unfortunately, the babies are not getting an equal share of blood and nutrients.
This is a really serious complication. If it isn't treated, then the risk of one or both babies dying is extremely high. There is evidence of difference in growth between the 2 babies, so one twin is quite a bit bigger than the other baby. Now at 16.5 weeks gestation, the only option for treatment available to us is to attempt to go in with a camera and look at the placenta, find the blood vessels that are connecting between the 2 babies and use laser to seal off those connections.
Laser on.
I'm kind of too high up here, so if I kind of go along there, yeah, just along the edge of the membrane, okay.
You'll always be thinking of a bad thing. It's just a worry. I wouldn't think I've felt any of this at all when Reese was born, because there was no worry. It was, to us, it was a common pregnancy. Where this isn't. It is a slow waiting game. It isn't nice, but hopefully everything will work out.
I'm gonna sound that. This one.
Laser on.
We keep Orla in hospital overnight and then perform another scan the following morning. And what we're looking to see on that first scan is simply, have both babies survived the surgery?
Now I'm going to lift your legs up here, okay? Was your plan always to get an epidural?
Yeah, they said to me to get it because of the epilepsy. I take whatever's going out.
Katie and Seamus are expecting their first baby. Katie has a diagnosis of epilepsy, so has been advised by her doctors to have an epidural.
In 2017, I started having seizures and I was in and out of A&E. It's not the photosensitive type. It's the triggers are more sleep deprivation, stress and stuff like that.
You're very calm.
I think it's epidural.
To minimise the stress of an unplanned labour, Katie was induced. Seamus had left the hospital because of COVID restrictions before the induction. They hadn't expected it to work quite so quickly.
They induced me or whatever, and then within 10 minutes the contractions started, and it was just like my stomach was moving, and I was like, oh my God, what is going on? Like, they tell me it could be a few days, and it just happened like that. You didn't have time to think?
No, I didn't have time to think. I was panicking. Normally, I'm not a panicky person at all. And it was just it was almost like a flop sweat hit me straight away. And then by the time I got to the hospital, she was well dosed with the epidural. She'll fly out.
Yeah, here's how she'll fly out.
Fly against the wall.
With his quirky sense of humour, Seamus is doing his best to lighten the mood and reduce any tension.
And what are the chances that it is a monkey? This is what we're hoping for.
A monkey baby?
Yeah. A monkey baby that can talk.
Do you know, he's just one of the funniest people I've ever met.
When did we first met? Probably when I was 14, you were?
Yeah,
15.
14, 15.
Just kind of hung out in similar circles, and I was chasing you a bit, I'd say.
Yeah.
And eventually she
When we told everyone we were finally together, and we were like, oh my God, we're going out now. But they were like, yeah, no shit.
Yeah, about time.
Yeah.
Well, look how amazing you did coming over, not thinking that you were that dilated. You're 10 centimetres, your baby's coming.
That's absolutely gas, I can't believe it. How long has it even been? It's not...
It must only be about 45 minutes or something, I'd say.
When I came in, I had been told that she was 2 to 3 centimetres, and you're thinking in your head for a first-time mum, it's going to be another good few hours before she gets to 10. So I examined her to see and was so surprised that first baby had progressed so quickly. She was 10 and the baby's head was just sitting there, so we kind of had to just get going then. And Seamus, are you going to cut the cord?
Yeah, as long as I can't mess it up, can I?
Are you sure you want to see down there?
Yeah, why not? Bit of crack.
Literally.
James has driven from home in Roscommon to be with Orla for a scan. After a critical surgery yesterday, this morning will reveal if both babies have survived.
This is the smaller baby over here, okay? Thank you. It's great.
Yeah.
The heart beating away.
Yeah.
And then...
And to hear the 2 little heartbeats the next morning was amazing, wasn't it?
That was, even when I driving up from at home, that's all you'd be thinking, just wanting to hear 2 heartbeats, and we were over the moon, we had got what we were hoping. And we had to come back for a scan on the Monday
morning, yeah.
Still happy to knew that we had 2 heartbeats from the Thursday, and we had to go in for the scan on the Monday, and
then things changed.
It is that horrible moment when you look and realise that one heartbeat has stopped. And no matter how much you've told them beforehand that it's a possibility, even if you've told them that the likelihood is really high, everyone always still hopes that that's not what you're going to find.
Unfortunately, the smaller baby's heart has stopped.
when you hear a bit of a silence, it might have been only for 2 or 3 seconds from when you heard the first heartbeat, and them 2 or 3 seconds it felt like a long time, and you knew the silence wasn't good. You just freeze.
It was straight away, oh, please let our other baby fight. And my God, she is fighting. She is fighting.
That's it, into your bum. Well done, well done, well done. Let your breath go. Try to direct that more than into your bum, less into your face.
as much as you can.
As a person with epilepsy, it's vital that Katie avoids overexhaustion, which could trigger a seizure. Luckily, her labour has progressed quickly, her epidural is working well, and she is very relaxed.
With her history with the epilepsy, you want to limit the amount of time she's pushing. In your head, you kind of have to be looking at her. Is there any signs of a seizure?
Excellent, excellent, excellent. Brilliant, and catch your breath, okay?
Fair fucks you. I'm knackered watching you, to be honest.
Everybody has their own preference about a birthing partner. I like to laugh, so I thought he was actually a really good birthing partner. And for her, I thought he worked really well. He also kind of eased my nerves a little bit as well by, you know, cracking in the joke and keeping her laughing and keeping things calm.
The epilepsy did worry me. I didn't want to say anything to Katie because, like, the less stress on her, the better. If she has a seizure while she's giving birth, what does that mean? What does that mean for the baby? Like, if she can't push and stuff?
Despite the speedy labour, the baby is now showing signs of distress.
So we want to be seeing her head being born with the next few. She is showing signs. You can hear even it's a little bit slower coming back up, you know.
The more that you do it, the more you get a little bit better at hiding that kind of focus and that little bit of apprehension that not everything could go smooth. Things could take a turn at any point.
You can see that much of her head.
Oh my God.
There's a human coming out, you know.
I know. Stop.
She better be sound.
Go on, you're doing amazing. Little bit more, little bit more, little bit more. That's it, one more time again. Fill your...
Katie has only been 2 hours in the delivery room, and already her baby's head is crowning.
Excellent, okay, catch your breath. Can I keep your legs like this until the next one? Mm-hmm. Do you want to look at the top of her head, Seamus?
Yeah.
He went down and had a look, so he said it was okay.
Yeah, it was all right, yeah.
It's not even a mess down there, are it?
So romantic.
It was beautiful, like, is the only word. It was, in a weird way, like, it was.
How much head can you see?
Literally, it's coming in. I'd say you've two more of them. Just keep.
Would you say that from your experience?
As a midwife.
I feel like you've been a midwife here before.
My midwifery course.
2 more of them yolks you'll have are good on you.
Yeah, you'll be fine. Shoot her out now. Stop messing.
The contraction there now, go on. You'll be laughing her out. That's it. Excellent, excellent, excellent. Go on and go with that, go with that, go with that, go with that. Oh, her little head's out.
Oh my God.
Okay, her head's out. Oh, she's trying to cry already. Can you hear her blowing bubbles?
Yeah.
It's an intense moment, but I think that's like the addiction of the job, that moment you just thrive for. You know, it's you in there, the head's coming, who knows what's next, but like it's happening with the next contractions. Okay. Within a moment, their whole life is just going to be changed.
Push down, that's it. Okay, open your eyes and look down. Oh, thank you!
Oh my God.
Congratulations, she's lovely.
No, she came out with like a full head of hair, 7, 8, like, you know, flew out.
He walked out, yeah.
Yeah, he was laughed out.
Oh, hello. Oh, no. Hello. Oh, she's beautiful.
Oh, you're okay.
She put her up on my chest, and I just thought, like, it's a whole array of emotions. Like, you're a little bit scared, but like you're so happy, and you couldn't imagine your life without her, and it's just nuts. And then to look at you and see just like how happy and like scared as well you look.
You're okay.
I'm fucking crying now.
You hear people always say, like, oh, it's an indescribable feeling, like, and it's that, like, until you're a parent, you know, that bullshit, like. But it actually is, like, I think I started crying as soon as she came out. And it's just like a flood of emotion.
Oh, you're okay.
You did that.
Oh, some lungs on you.
Oh my God, I can't believe that.
Oh, well done.
I know.
She's perfect.
She is perfect.
When she asked me to cut the cord, I was surprised at how gristly it was. It's like a bit of like the fat off a steak or something. And you're like, you have to proper hack through it. Like,
Yeah, good on you.
we actually lost it as well.
It's floating around the apartment
Somewhere in the apartment, we don't know. Like, so hopefully when we move, we don't want to be leaving that around. Like,
That's it, she's detached from you now. She's her own person now.
it is indescribable. You're like, oh my God, you now have to teach them everything. Like, and they're gonna get to experience everything for the first time. Like, it's just mad. It's so mad.
It's nuts out here, kid.
Orla and James suffered the devastating loss of one of their twin girls, Leah, a few weeks ago.
A lot of our friends don't realise that I'm still carrying Leah. Just 2 friends actually asked last week, they were like, do you mind if we just, what happened to the other baby? And when I said that I'm still carrying her, they were like, oh my God, we didn't even, like, I suppose people aren't aware.
Clinical midwife specialist Jane will be supporting them throughout the pregnancy with how to cope with the bittersweet feelings of loss and hope.
So I feel so guilty sometimes when I get upset because I still have one lady relying on me.
It is an extremely difficult journey to embark on because you have grief living absolutely side by side with joy. So it's a huge adjustment.
And it's okay to let it all out.
For years to come, we would like to think that Freya's birthday, will be a happy time. And perhaps I might say to them on the birthday cake, other couples have said to me that in this scenario, they've a birthday cake and they might get a little butterfly and they might place a butterfly on the side of the cake. So Freya will know it's a happy day, but she'll always know that there was a little piece of Leah included in it.
The idea of what I'm going to show you today is to encourage you to create memories and have connections. Think about having these for the 2 girls, okay, and you need to take them, put your smell on them, and then perhaps, when you say your final farewell to Leah, the one goes with her, and then Freya, when she's old enough to understand, you'll say, well, you have a matching comforter, your sister also had one, and she has hers with you, and you may even at birth put one with one and swap them over.
I suppose Jane, she has been through this with couples and she knows what to say to us, and just to even have the little teddies going home the last day was lovely, and there's one for Reese and one for each girl.
Orla will have regular scans to keep a close eye on baby Freya's progress until her birth by Cesarean section.
This baby is flying around, so she is.
I feel we're a lot stronger, and I kind of get comfort in the fact that they're identical twins, so that I will know what Leah looked like. It just gives me a little bit of comfort. And today, we did our scan today, and just to hear that Freya is doing so well, it just means the world.
And there's the 2 little heads together, so see the size difference.
Yeah.
Can I take a little picture of her for you?
Do, please. Yeah.
I get very upset when I start thinking about delivery, because I suppose at the end of the day we're going to be bringing life and loss into the world. But I do know it will be a section, probably around 38, 39 weeks, and I've comfort knowing that it's planned.
He's gorgeous. I love his hair.
I know, mad head of curls, but I did tell you. You have such hope and sadness, and it's going to be a tough one.
One of the things that I learned early on here was that the provision of life or birth was tantamount to the daily lives of the people I was going to deal with. And they were all affected by the beautiful things in life, but also the death of a baby. That's probably something that is in my own background, because I was a twin and my twin didn't survive. In a different age, admittedly, the attitude was that you had another baby, that you hadn't a total loss. But that was not reflective of the loss that the mother was feeling in terms of that dead baby. In the Rotunda today, that wouldn't happen. Memories are sacrosanct and protected.
Orla is now at full term, 5 months after receiving the sad news about one of their identical twins, Leah.
On that Monday at the scan where we had been told that there was no heartbeat for Leah, the first thing Jane said, and which was actually lovely, was she said, you know what, you should really give baby a name. And it just suited because I said little Leah and fighting Freya.
The couple have plans to honour Leah with a blessing and a burial.
The date that we found out that she wasn't still alive, that marked that day down, and we'll never forget the 15th of March.
15th, yeah.
That, you know, we'll use that as an anniversary for Leah. So.
Yeah.
Oh my God. She's gorgeous.
That's what we want to hear, isn't it?
Yeah.
And the big old stretch there. Fabulous.
Oh, birthday. Congratulations.
I suppose you have such hope and sadness, but yet I have to be so hopeful because we have a baby that is dependent on us.
Come on over and meet your little girl. She's gorgeous. Joe? Oh, I think she's just good. Yeah, she's the red hair and everything. I'm just so glad she's here.
And for Freya, you know, in time, as she's older, she'll have to be explained that she started off life as an identical twin. You know, just to be able to show her that the fight that she has put in to survive.
Oh, hello, gorgeous. Oh, we have been dying to meet you for so long. And Lan's just wonderful. I hope you like pink. I hope you like pink. Mommy has lots of pink for you. Oh, you are the cutest little thing.
Welcome to the Rotunda, the longest running maternity hospital in the world and the busiest in Europe.
We're here! Woohoo!
It has seen the birth of close to 1 million Dubliners, and this year, some 25 new babies have been added to that number every day.
Black hair just sticking out.
Hello!
Oh my God!
I know.
It's a place of extreme highs and devastating lows. During the pandemic, one of the most challenging times in living memory.
I'd like to be in there, but the numbers aren't going down at the minute.
We have a date.
It's agony and ecstasy side by side as people experience events which will change their lives forever.
I'd do it again.
Events to be remembered and retold for generations to come.
Pandemic babies. Look at you.
So I'm a firefighter paramedic with Dublin Airport Fire and Rescue Service. I'm completing my placement now as part of my paramedic training to enable me to be competent and confident in the pre-hospital delivery of newborn babies. We attend Rotunda Hospital very regularly. Being based at Dublin Airport, pre-hospital deliveries or near pre-hospital deliveries are very common. And people travelling through the airport and travelling over Ireland who may divert into Dublin Airport because of this pre-hospital delivery that's imminent. Seeing a baby enter into the world for the first time, you're overjoyed that things have gotten to where they are successfully, and you know, we've assisted in that. We've, I suppose, a very small part to play in a big part of someone's life.
Kathy is 24 weeks pregnant. This is the fourth child for her and her partner Darren. They met and got together as childhood sweethearts.
I was 14 at the time and he was only 15, and I knew when I first seen him that I loved him. As childish as I was only a child at the time, but I just fell head over heels for him.
And I was running the opposite direction.
Yeah, he was having none of it. I mean, none of it. Until we kissed, and then that was it. Kissed.
One kiss.
Up the backs.
Here we are 15 years later.
Yeah, but after that, we got pregnant very young. I was 16 when we got pregnant. We done it. Here we are, this many years later, so.
Expecting number 4.
The last.
Oh, but the karyotype isn't back yet. But
They've been referred to the Rotunda from their local hospital, where their 20-week scan revealed complications with their baby girl.
I think we both knew when she was focusing a lot on certain parts of the baby, we knew something wasn't right. And then when she said, I'm going to have to call in a professor, then we both thought like, oh, well, something's going on here. And he came back and he checked and he said, your baby has CDH, it's congenital diaphragmatic hernia.
the stomach is kind of going up and down. You can see a little bit of it here in the abdomen.
He just said, don't Google. That was his words, was don't Google anything. But of course, I Google everything. But we were shocked, absolutely shocked.
Has much changed from the last time?
No, I don't think so.
It's a hole in her diaphragm, so her diaphragm isn't formed properly. So it allowed then for her stomach, her spleen, her liver, her lungs, everything's pushed up into her chest. And her heart then is moved over to the right side where it should be more to the middle. So her lung didn't get a chance to grow properly.
The next thing is to decide, is this bad enough whereby we would think of referring you out for a procedure, which wouldn't happen in Ireland, where they put a little balloon into the baby's windpipe, blow it up, and then the secretions from the lungs, which should come up and out the windpipe, stay in the lungs and expand the lungs and push everything out of the chest. But because that's very invasive, it has only really been done where things are very critical.
Our baby's not well at the minute. She's not.
No.
No.
But she'll make it.
She will. If she's anything like the other three, she'll be a warrior. So she will, and she'll be fine. Won't she?
You're right.
Yeah. Yeah.
In the neonatal ICU, Abiba is here to see her twin girls, who were born prematurely 2 days ago at just 29 weeks.
I feel like that she was uncomfortable for them, right? No, she's sleeping now. Sorry? She's comfortable. She is.
A few months ago, Abiba left her home and family in Ghana to take up a position in Ireland in the healthcare sector. When she discovered she was pregnant with twins, she faced a difficult decision.
I didn't have anyone here alone. My husband is back home. For me, it was a great opportunity to secure a job here. So I was caught up between staying or going back home for the support. And then in the midst of all of that, thinking of what to do next was when the babies came. They had to bring them both out immediately.
Is she crying? Yeah, because when I touched her.
When I see them crying, I'm like, do they cry? Because I feel they are so tiny. They haven't reached that stage. So everything seemed strange to me. And I would get so emotional. I felt they were too tiny to be going through all that they were going through. It's too much for them. I felt like it was too much for them. And it made me have this guilt. I think it's more of a motherly guilt that I brought them into this world, and look at what they are going through. Look at how much they are suffering.
The twin sisters, named Mardia and Radia, will be cared for in the NICU until they reach full term.
It has been a tough moment for me. Like, I would say this is the toughest thing I've ever experienced in my life. To be in a country that I know nobody.
So the Rotunda is the oldest continuously operating maternity hospital in the world. It was founded by Bartholomew Moss in 1745. It's a very old building, so at the moment there's some renovations happening in the front hall of the hospital, and they're lifting some flagstones in the front hall. So we're hoping to bury a time capsule under the flagstones to give a flavour of what's going on in the world at the moment, stuff and vaccines, and we gather some mementos of what it's like in 2021 in the Rotunda. It's very ad hoc. He's digging up the floor. Would you fit a time capsule on there? Yeah, loads of room. Someone can dig up with this film maybe in 100 or 200 years' time and see what was going on in the summer of 2021.
So do you have your flights booked?
Yeah, for Monday morning, 6:30. Mom's gonna come with me because we need somebody here with 3 other kids, so we need stability for them. So Mom's gonna come with me for the time.
Now 27 weeks into the pregnancy, Kathy and Darren are back with Professor Daly, who has estimated that if they do nothing for their baby, there is a 66% chance that she will die shortly after delivery. However, an opportunity has arisen to see a specialist in Belgium in the hope of increasing the baby's chances of survival.
We got a call on a Tuesday from Professor Daly to say that he was getting in touch with Professor Jan de Prest, who is the top man for feto in Belgium. And he rang us on the Tuesday and said, look, we want you to go over for a consultation.
And you have an appointment for Monday.
You have an appointment for Monday. Literally, that's how it went. Then on the Thursday, I had no passport. So it was a dart and a dash.
She's practicing German all week. It's not German they speak though, sure it's not.
Is it?
Isn't it? No.
I'm not practicing, that's what Mom said, I'm fluent.
So they speak French and Flemish, I think, don't they?
Right. Flemish.
No, no.
I'm a bit Flemish this morning, yeah.
So the baby's head is here.
Okay.
So you'd expect to see the heart down here, but the heart's actually up there.
Okay.
Okay, so the heart, as you know,
to
is
the
pushed
right.
to the right, and that's because the stomach is up. Now, most of the liver, I don't think, is in the chest.
If the Belgian specialist decides that a procedure is viable, he can attempt to insert a tiny balloon into the baby's air tract, giving the lungs a chance to develop naturally in the womb. But this is risky.
The difficulty is that putting instruments into the womb can cause the membranes to rupture, can cause the womb to contract, and premature labour happens frequently. If you look at the trials, it happens in almost half of cases. And if you go into labour early and deliver the baby, and there isn't somebody there who's trained and capable of taking the balloon out, then the baby dies because it has a blockage in its breathing tube.
If the procedure goes ahead in Belgium, Kathy will need to stay close to the hospital there for up to 6 weeks in case she goes into early labour.
Because we, in our heads, knew that if we went to Belgium, this was the place we could go to try and help her. That was the easy decision. But then when you're looking at everything around it, like the fact that we have 3 other children, the fact that financially, yeah, being able to try and get money together. I mean, like, there was a hell of a run around. Darren had to go in and get money out. My dad got money, my uncles, aunties, everybody supported it.
I don't know, it's a lot to take out for you.
And it's sad,
You're not being able to go because both parents can't be away from the kids for so long, which means the other parent has to go through it on their own.
Because we have a 1-year-old at home and she's still only learning everything, so it's heartbreaking knowing that we're leaving, that I'm leaving my family. But I know it's for the greater good.
We get through it.
Yes, we will.
She will make. That's the wee warrior.
I have to be positive and I have to think ahead, and I am thinking ahead that she will be here and she will be okay, and we have a fight ahead of us, but we're prepared for it. We're ready. We are ready.
In the neonatal ICU, twins Mardia and Radia are making good progress. And Abiba is already wondering when she'll be able to take the babies home.
The next challenge is to get, I think, Radia back over the kilo mark, because I think she went under the kilo.
Yes.
But they're handling beautifully. They're doing everything that we want them to do.
Wonderful.
Yeah. So really pleased.
I'm happy.
Yeah,
I'm pleased, yeah.
Yeah.
In terms of looking after a preterm baby or a very preterm baby, whether I like it or not, girls are definitely stronger than boys. And there are studies that show that girls of an African heritage are stronger again. So it certainly was a joke or a laughing moment for myself and Abiba when I was chatting to her that she has the strongest of the lot.
Abiba is being discharged today. Although delighted with the twins' progress, she has to face leaving hospital without them.
When I was being discharged, I felt that I'm leaving my babies behind. That is not what mothers do. Mothers are supposed to take care of their babies. They're supposed to be there for their babies. They're supposed to be there when their babies are crying. So going home and leaving those babies there was very emotional for me. It was very hard for me. This journey has been the hardest ever. Ever.
Kathy is 28 weeks pregnant. She's arrived in Belgium where the specialist has agreed to attempt the procedure today, in the hopes of increasing the baby's chance of survival from just 33%.
I still get nervous from this, still, because you always know what can go wrong. I say he to every baby, yeah, so I don't even know if it's a boy or a girl. It's a girl, yeah, I'm sorry, yeah.
The team will make an incision into the womb and with the help of a camera, attempt to enter the baby's mouth to insert a tiny balloon into her windpipe. They hope that the procedure doesn't bring on labour.
So I was awake from the surgery, but I could actually see on the camera screens exactly what they were doing.
The balloon is in here. That's what it is. This is handmade.
see them actually place the balloon, because it's in utero, it's in your belly, like it's something, to me it's unheard of. I never knew this was possible. But to actually watch it and to watch it happen in our baby, it really was. It was like an out-of-body experience.
Probably on the lower lip, I hope here you are. Is the mouth opening? Should be straight in front of you. Can the mom see it?
Yeah.
In the windpipe, I think. This is the tail of the balloon. That's where you pull on later on. That's it.
That was incredible to watch. It was incredible to watch. Yeah.
Just 1 hour after the procedure, Kathy is experiencing mild contractions.
How does the next 24 hours look like? I mean, staying here, this is surveillance against contractions.
Yes.
And she has a bit, because the womb doesn't like that, so it should go away.
But you're happy that everything went as
So
good
far
as
so
well as
good, I
possible.
always say, but
Yeah.
one step at a time. What can go wrong is membrane rupture and delivery earlier than required.
We were ringing every night. We got our prayer to St. Jared.
So we done that as a family every night.
Every night the phone call was made, the prayer was said, the candle was lit.
We were just thinking like, please let it have worked, that we're not doing this for nothing. Our proper chance is starting.
The fight had started.
Yeah.
We are, you're still at the front.
Cheers.
Still leading the pack.
Abiba has been discharged from the hospital after the birth of her preterm twins, Mardia and Radia. She's been expressing milk for them and has been able to visit for up to 8 hours per day. But now, without her husband or any family in Ireland, a juggling act lies ahead.
Radia is going to be discharged first, and then Mardia will follow, and I don't even know when. So bringing Radia home and leaving Mardia here is hard. And I can't leave Radia home and come and attend to Mardia here. And I can't abandon Mardia here because I'm home with Radia. That's a conflict for me.
Fortunately, the twins have not suffered any significant side effects of being born premature. However, all preterm babies need to have an eye test to rule out any damage to their sight.
Years ago, when we started getting very good at intensive care for newborns, especially preterm babies, we were seeing quite an awful lot of blindness in graduates from neonatal units. And we figured it out over a number of years that this was related to the amount of oxygen that they were getting. So we gave them the amount of oxygen that they need, but we also screen their eyes regularly, which is quite a tricky procedure that the ophthalmologists do to look for any overgrowth of these vessels at the back of the eye.
Well done. Well done, sweetheart.
To have both of them home, I see that as a dream, going on with our normal lives, and know that there is nothing going to happen next. There is nothing we are going to think about, we are going to be worried about again.
Oh, she's doing great.
All right.
Thank you very much.
Hey, good to see you. In you come.
6 weeks after Kathy's procedure in Belgium, the doctors there have successfully removed the balloon from the baby's air tract. She's now 34 weeks pregnant. Today is Professor Daly's first chance to see if there is an improvement with the size of the baby's lungs.
Yeah. You can see the colour difference. You see, like, obviously it's all shades of grey, but...
Brighter now, so it's more easy to see.
Yeah, gosh, that's very impressive. And let's just keep our fingers crossed, you know.
We asked Professor Daly what was his take on percentage of the baby living, and he gave us a 60% chance of survival. And 10 minutes later, when we came out of the room, we were sitting in the corridor, and I just says, I wouldn't even be listening to that. Our wee woman's going to be with us very soon.
Yeah, that's where Darren's positive and I'd be more realistic. So I see the percentage, but it's not a coin toss of a 50-50.
Yeah.
We're on the better side of that now, and hopefully we stay on the better side of that. Hopefully. I'll be able to say at the end of it all that I tried and done everything I could for her. So that's the main thing. Whether it be 6 weeks or 6 months, I know now that we done everything we could on that end.
There's nothing else you could have done. They have embraced all of this difficulty, and I would say they are both very optimistic, glass half full kind of people. And I just really, really hope it works out, you know.
For dads, this has been a really difficult year. They haven't been able to attend the antenatal visits. A lot of times they haven't been able to attend scans. So I know a lot of them have said to me that they felt that they didn't connect as well as they might have done with the pregnancy. Fathers nowadays are much more connected and much more hands-on than fathers of previous generations. You'll see them encouraging their partners when it's pushing. They want to cuddle the baby themselves. And because their period of time in the hospital has been very limited, that has been hard on them.
It's been 10 weeks since the birth of Abiba's preterm twins. Today marks the end of what has been a very difficult juggling act. Her husband Raheem has arrived from Ghana, and now their second girl is healthy enough to be fully discharged.
I wasn't sure of the outcome. I wasn't sure of how we are all going to handle this, myself and them as well. But they made me realize what a strong woman I am. I feel that if you're not strong, you can't do this.
It's Mommy. It is Mommy. How are you?
Hello, Princess. Marty and Radia have had an excellent course through the neonatal unit. They've required very little support from us. They've been little rock stars.
See, I'm in whites. I'm in all whites, and my husband is in all whites as well.
And what does that mean?
Victory.
Yeah?
Yeah.
Very good.
Yeah.
Well, she's been at the hospital for more than almost 3 months now. So when we got the news that she'll be discharged today, we were very, very happy. Very happy and very, very excited. And her sister as well can't wait to have her home. We all can't wait to have her home.
This is for the girls and for getting through their NICU journey successfully.
Thank you, us. Thank you so much. Bye. Thank you.
I'm going to tell them the story. I'm going to make it an interesting story, not a painful story. I want to remember and talk about it as what a strong woman having strong babies went through.
Hey, Marty. Daddy's here. Daddy.
Lauren and her husband James are expecting their second baby.
It was a bit crazy that we'd have. I think Thomas was only gone one when we found out I was pregnant again.
You're only moving into our house as well.
Yeah, we just bought a house. So we were just moving into that, found out I was pregnant. And then it was maybe when I was 14 weeks.
Yeah.
We found out about the cancer. So then it was just a different level of panic at that stage.
Results from a smear test revealed abnormal cells, which when further investigated led to the devastating diagnosis of cervical cancer.
When we got called in from the results from the biopsy and they confirmed it, it felt like our world was shattering.
Yeah.
Because obviously with the pregnancy as well, you didn't know what was going to happen.
I think the first thing I actually said when they told me it was cancer was, am I going to die?
The couple had an initial discussion about their options with a consultant gynecological oncologist, and then faced the heart-wrenching dilemma of what to do next.
At that time, they discussed the options with her, which included surgical treatment, which would be one of the mainstays of treatment for this stage and type of cancer, and that would have involved termination of pregnancy to proceed with the surgery.
The thought of leaving our son without a mother was killing us. Well, it wasn't an easy decision to make. It really wasn't. It tore us apart.
Sounds great, doesn't it?
Lauren and James then got a clearer picture when they spoke to a consultant gynecological oncologist who had a similar case to theirs before.
He actually had a patient, I think 10 years ago or so, wasn't it, that had the same thing, the cervical cancer during pregnancy. She did the chemo and she delivered the baby, and then...
They're fine, they're perfect, they're healthy. When we heard that, it was like, brilliant.
That's a no-brainer.
That's a no-brainer. So he recommended 4 or 5 rounds of chemotherapy. With the baby being in the womb, and then the placenta there, it's acting like a shield. This is the way it was explained to us. So when she was getting chemo, the placenta was taking the hit. So it was filtering out all the bad stuff.
Hi, how's it going? How are you? Everything was stable over the weekend? Yeah, good. So I'm just going to have a little look myself.
I think it was 2 weeks after I had the first chemo, my hair started falling out. That was actually really hard. I didn't think it would be.
Of course it was going to be hard. You're a woman. It's your hair.
I know, but my hair wasn't. It wasn't a thing.
It was your hair.
Like that's when you're like, okay, I have to wear a wig or I have to wear like a headscarf. Like that's when I really started feeling like I look like a sick person now, because until then, well, I don't think I looked too bad.
You still don't.
But, cute little face there.
Just like your mummy.
Yeah.
Every bone in my body was just aching and sore. I couldn't walk up or down the stairs. Felt like my ankles were going to snap or something. But I think the worst part of that was then realising that like when I couldn't lift Thomas, just I felt so weak from it that I didn't want to risk lifting him down the stairs and carrying him just in case something happened.
Any idea what she'd be weighing at?
So what did we say last Friday?
She was 3 pounds last week.
3 pounds last week.
It was after the second cycle of chemo. They noticed that she wasn't growing as well as she should have been.
1.3 kilos, so just under 3 pounds. Yeah, so probably in and around the 3 pound mark, I would say. Yeah. The baby's growth isn't what we would hope, and so we have to plan a slightly earlier delivery, because we know that at the time of birth, not only is Lauren going to have her baby, but also she's going to be undergoing significant surgery for her cancer, and this will involve a hysterectomy and very extensive dissection of her lymph nodes. And so if she requires an emergency section, it won't be possible to optimally treat the cancer at the same time. So we want to very much avoid that.
The baby will be delivered early, at 31 weeks, under general anaesthetic.
So if you think of that's your wound, and then that's the bottom end and the top, that usually it would be along here. Because that's close to the cervix, they would try to, and even though they do need to do a lot of dissection around that area, they're going to do it higher up incision. Yeah.
Okay.
Congrats.
That's okay. Never just came down.
Count downstairs.
Yeah.
Kathy and Darren's baby girl has made it to her due date. Kathy is fully dilated and ready to push.
To see that she can stay this strong with everything she's after going through and still has to go through for our 4th baby. I absolutely adore her for doing it.
Big hard push.
And the love I have for her is definitely more and more now than it ever was before.
The neonatal team are on standby to intubate the baby at birth in the hope of beating the 40% chance of her not surviving.
So normally when a baby is born, they take a breath and their lungs gradually inflate, but they also swallow a certain amount of air into their stomach and into their intestine. And with the diaphragmatic hernia, that's a problem because the intestine is actually in the chest cavity. So it's important that we intubate these babies as soon as possible after they're born, and that if preferably before the baby actually cries at all, if we can.
Look at the hair. Can you look down? Do you want to see her? Look at all the hair.
Happy birthday! 1310!
Look.
So excited.
Alright. You cry.
Oh, she is a cutie. Now.
Oh, wow.
That's very brilliant. I could feel it.
The colour change there, good.
Yeah. That's 41%. Well done, guys.
She's breathing on her own. The reason she's gone quiet is because when you put it through your vocal cords, you can't cry.
Yeah.
So that's a good sign.
She's breathing on her own.
Yeah, no, she's breathing on her own. Well, we are helping her breathe, but she's also breathing herself.
Yeah.
Well, she'll give her a little bit of help.
The intubation is successful, so now the baby can be brought straight to NICU for further assessment.
We've got an incubator outside the door, so we're going to move her over to the intensive care. Yeah, and we can see her close.
Very good. I see. Yes, that's like four.
The 3 kilo baby we're saying, isn't it?
About 3.
Just minutes after delivery, Kathy and Darren's baby is responding well in NICU.
The chest x-ray shows a very large left diaphragmatic hernia. There's a lot of Sadie's stomach is in her chest cavity. You can see her stomach because that's the area where the tube goes into. But despite that, there's a reasonable volume in her right lung. With a diaphragmatic hernia of this size, the baby will be extremely sick in large amounts of oxygen and on high pressures on a ventilator, whereas in fact Sadie Rose was quite easy to ventilate and she was in 40% oxygen, which is, you know, it's extra oxygen, but it's a small, it's not an awful lot compared to most babies with diaphragmatic hernias like this.
Can you see it? Look at that. That's so beautiful. Oh, she's so tiny.
She's displaying great signs and is breathing successfully.
Look at her. Oh, Kathy, she's just gorgeous. Isn't she, Mommy?
We think the transport team will probably be here before 5.
The National Neonatal Transport Programme will shortly bring Sadie Rose to CHI at Crumlin, where staff there hope to repair the hole in her diaphragm that has caused all of her problems.
Right. And can we find out the visiting times and all that, or will there be visiting times?
I think if somebody's in intensive care, they'll let you in this evening anyway, you know.
Right, okay.
Seeing your baby being born and then having to be rushed away, kind of preparing for that, I don't think anybody can. That'll be in the moment kind of thing.
Yeah, I know.
It's 11 p.m. Chinese national Longfen has been admitted to the hospital to the prenatal ward in early labour.
去医院的那个晚上，其实是挺无助的，因为疫情，去医院只能一个人，然后他没有陪着我，总觉得不是很安心。
Longfen doesn't speak English, until it is time for her husband to be able to join her, staff will use the hospital phone translation service to communicate with her.
We were communicating through the notes that we had, through body language and the phone. We were able to use the phone initially to get some information.
Just 3 hours after being admitted, Longfen's contractions are now strong and regular. Now her husband Dong can be with her until after the baby arrives.
Labour this is established labour, so you're going to have a baby today.
Oh yeah.
Just what time I'm not so sure, but look, we'll work that out. I think the first thing to deal with is the pain.
Whilst you can do a lot with body language, and body language says a lot more than you think, yes, verbal communication is very important for our job.
You do, and I do, but you don't. You can take the mask off.
我们来爱尔兰10年了，然后我老婆她来了3年，她一来我就认识她，去接送她，然后有3、4个月之后，我就跟她谈恋爱，
然后去海边散步，然后我们就慢慢的一步一步的谈恋爱。
我们中国人会比较害羞，慢慢的没有明白的表达心意，但是慢慢的让对方感觉到我们是怎样子的为人，然后慢慢的让他懂得我的心，然后我们慢慢开始谈恋爱。刚开始我认识他的时候，我比他大8岁。从一定的意义上来说，我觉得他的思想文化会跟我会有点不一样，会有点小女孩的性格。我知道的呀，可以了，可以了，可以了。在内心深处就会喜欢一个人，也就会接受他的这些。小的这些缺点，而且慢慢随着他长大，我觉得他会是一个好老婆、好妈妈。
他年纪比较大一点，感觉会更疼人，然后更稳重一点。
小林子啊，好勇敢啊！
打吧。
Yeah, it's fine now. Yeah.
你手给我扶着脸。
You did fantastic. Absolutely wonderful. You'll have a morning baby. That's what we want.
Yeah, thank you.
Nice, gentle delivery.
出来的时候，星星还在睡吗？
睡着了啊，睡着，你不用担心，星星睡得好好的，2个阿姨找我呢。
第一个小孩他比较活泼可爱。
And your baby at home was 1.5.
Yeah.
Lovely.
因为我年龄比较大，30几岁才有小孩，所以当第2个小孩来的时候，我当然是很期待。
So now we need a progress report to tell us if this baby is coming out today or tomorrow.
Oh yeah.
Joking. Today.
Should be today.
It'll be in the morning time. Maybe a breakfast baby, huh?
他说他跟你开玩笑。
直到那个宫缩疼痛来的时间越来越短，越来越痛。
小林子太辛苦了啊。
No, my dear.
明年带你回国啊。知道不生了。真的觉得无力，你也在身旁，你帮不了他。Excuse me, why she feel cold and shaking?
The labor is very powerful.
应该要让男的也去体验一下生产的这个痛苦，然后怀孕、孕期这个各种不舒服的 状态，让他们体验一下，其实怀孕也是不容易的。
好，小妮子，小妮子，小妮子，老公在这，我在这，你这怎么了？啊，这有点不对劲啊，这怎么了？
This morning in the Mater, Lauren and James's baby has been delivered by C-section at just 31 weeks.
Penny was delivered. It was 10:30 in the morning. She was being transferred straight off to the Rotunda. The ambulance came and collected her.
Lauren is still under general anaesthetic for further surgery to have a full hysterectomy. The National Neonatal Transport Programme resuscitated and stabilised Penny when she was born and is now transferring her to the Rotunda ICU.
The admission, ventilator.
When Penny arrived from the Mater Hospital, we were expecting her to need help with her breathing because of her prematurity. She was suffering from what we call respiratory distress syndrome. She came in ventilated on a breathing machine, and we had to give her a medication, and she actually had a great response to that.
Once he got word that Lauren is out of theatre, James left the Mater to come down to the Rotunda to see Penny.
Yeah, just going up to see me baby. Transferred there from the Mater.
So where's baby up in the NICU, was it?
NICU ward, yeah.
What's the baby then?
Penny. Well, the head is all over the place, but obviously Lauren's up in the Mater, so it feels like, yeah, with the two hospitals, you know, it'd be good if I could turn myself in two and be with both of them. She's so small. I know I'm not. Thank you.
My name is Carol. I'll be looking after her today.
Thank you, Carl. She's so small. My head is still in the Mater with Lauren. I just want to know. I just want to hear her. Hear her talk to me. I know she's gonna be fine, but I know when she wakes up, she's just gonna want to be here.
Look, this could have taken a turn for the worst.
Yeah.
But we're beating it, and we're gonna have a little girl at the end of it.
At least we did have something to focus on. I actually don't know how people would do this without.
I don't know how you done it while you were pregnant. So I keep saying to her, like, champion.
If it wasn't for you, like, I wouldn't have survived it without you.
Yeah. Sure, look, this is what we have to do. I'll always be there. That's what I married you for, sickness and health. So I kept saying
But
to
it
you,
wasn't
kept
meant to
saying.
actually happen.
Hey, yeah.
Lauren will have follow-up tests to assess her recovery and to determine if she is cancer-free.
Now that Penny's here, I don't know, it just makes you feel a lot less stressed. But if I need more treatment, that has to be done. So we'll just get on with it, really.
We're at the end of it.
Yeah.
Been through enough.
Yeah, we're due a bit of good luck.
Exactly. So we have our lucky Penny now.
Yeah.
And she'll bring you luck.
要睡觉。
不是睡觉了没？你不是睡着了吗？
Are you ready to have a baby? Happy days. This
你
is
准备
great.
好了小孩的
I'm
到
ready
来
to see this baby. I want to see this lovely lady. The epidural has helped a little bit, but I think sometimes it's just time to get on and have a baby. And all we're doing now is waiting.
Our body was very, very, very much in tune with what it had to do, and did it very well.
Go on, big breath. Hold and push. Push down and down this way, down into your bottom. Yes, that's good. That's a good one. And let it out.
痛的我感觉我从来没有经历过这么疼痛的感受。
偷偷看到啊
Baby's here.
Yeah.
啊，我感觉真的要崩溃了，太难了。
Okay,
小林子
if you have the
加油
feeling, go with it. Go with
加
it.
油，小林
Oh!
子，小林子加油！哎呀，厉害，小林子啊！
中国有句话说得好，为人母则刚。想当妈妈，我觉得真的是付出真的是很大，然后
You're doing okay, Lynn. You're doing fine.
出来了，出来了。
5 o'clock. Give me one more push. Hello.
Oh.
Hello.
生了。
Hello. 5:01 in the morning. One beautiful baby. One beautiful baby. Well done. Look what you did.
小林
You
子
did fantastic.
看到他的那一刹那，我感觉我运气所有的不是都是
Happy baby. Happy mama. Now let's dry. That was so quick. Very good. You could be booked for speeding. You went so fast.
哎呦！
你好丑啊！
有。
你会感觉，哇，你有很多期待，你想要给他好的生活，你想要对他给他很多的爱，多陪伴他。
怎么有鼻涕吗？有没有？
没有，不要擦，太热，不要擦啊。
These babies who will be around long after I'm gone, and filling up the Irish football teams and rugby teams and running the country and the leaders of tomorrow. When I'm on my pension, they'll be paying into that into the fund.
Your next baby will be 4 kg.
My girl said no more baby.
Okay.
再多一个男孩，那你不想要吗？
精神精力什么都不够，我觉得有2个小孩已经足够了。
但是有一个男孩的话，对于中国人的思想来说，确实女孩嫁出去，可是男孩一直陪在身边啊。
我不喜欢。
OK。
完成了，不生了，好不好？